Good morning and welcome. I'm Allison Brashear, the Dean of UC Davis School of Medicine. Thank you for joining us today for this important event on the intersection of social justice, health, and well-being. As one of the most diverse medical schools in the country, ranking 7th for training primary care physicians, the heart of our mission is to provide all of our patients with the best patient-centered care possible and to improve the health of everyone in our community. One of the ways we do this is by translating our leading edge research to our patients' bedside so that we're giving all of our patients access to the most effective life-saving treatments and care. However, the pandemic and systemic social injustice has made it very clear that we need to do more to ensure that everyone in our community has access to high quality and culturally sensitive health care that they need and deserve. I'm honored to be joined in this important discussion by two special guests, UC Davis Chancellor Gary May and Dr. Valerie Montgomery Rice, the President and Dean of Morehouse School of Medicine. Now, it is my pleasure to introduce Chancellor May. He is a remarkable leader, known for his passion in helping others succeed. He believes success is best judged by how we enhance the lives of others. Throughout his career, he has championed diversity and mentorship in both higher education and in the workplace. He's created nationally recognized programs to attract, mentor, and retain underrepresented groups in STEMs, the fields of science, technology, engineering, and math. Welcome, Chancellor May, and thank you for joining us this morning.
Thank you, Dean Brashear. Hello, everyone. It's really a great pleasure to be here for today's event, focusing on the critical nexus of social justice, health, equity, and well-being. I want to thank Dean Brashear for inviting me. First of all, I also want to acknowledge her leadership at such a critical time. I'm incredibly proud of the leadership and the innovation that UC Davis Health and our School of Medicine has shown during this public health crisis that we're undergoing. The pandemic's impact on our economy, its disproportionate impact on communities of color, and the extent of nationwide protests following the police killings of George Floyd, Breonna Taylor, and others, all point to nagging inequities for people of color. I believe higher education can be a part of the solution, however. Academic leaders are in a unique position to bring access, opportunity, and advancement to all. That's how we build a better tomorrow. We know from research in the field of health that diversity leads to better outcomes in medical care, research, and education. And beyond that, I believe that embracing diversity and inclusion is essential to our humanity and our progress as a society. I'm talking about the full array of nationalities, the full spectrum of socioeconomic and cultural backgrounds, along with a wide variety of political views and gender identities, and a rich diversity of talents and skill sets. I'm looking forward to a great discussion with Dr. Rice and Dean Brashear today. Speaking of whom, it's my great privilege to introduce my dear friend, Dr. Valerie Montgomery Rice, President and Dean of the Morehouse School of Medicine. An OBGYN and recognized infertility specialist and researcher, Dr. Montgomery Rice provides a valuable combination of experience at the highest levels of patient care and medical research, as well as organizational management and public health policy. She received her BS in chemistry from the Georgia Institute of Technology and earned her medical degree from Harvard Medical School. She completed her residency in obstetrics and gynecology at the Emory University School of Medicine. Dr. Montgomery Rice is dedicated to the creation and advancement of health equity. She lends her vast experience to programs that enhance pipeline opportunities for academically diverse students, that diversify the physician and scientific workforce, and foster equity in healthcare access and health outcomes. Among her many awards, she has been elected to the National Academy of Medicine and been presented with a Lifetime Achievement Award through the Horatio Alger Foundation. She also received an honorary degree from UMass Medical School and an honorary degree of Doctor of Humane Letters from Rush University. I think she would agree, though, that one of her greatest achievements has been acting as an early mentor for a certain UC Chancellor. Please join me in giving a very warm welcome to the President and Dean of Morehouse School of Medicine and the first woman to lead a freestanding medical institution, Dr. Valerie Montgomery Rice.
All right, thank you. Thank you, Gary. And Gary is correct. Dr. May is correct. My greatest asset to the world has been serving him as his mentor when he was a freshman at Georgia Tech. They had a great program for partnering senior students. I was only 1 year older though, with the junior ones. And Gary and I formed a bond then, and it has continued. So Gary, thank you so much. And thank you, Allison, for having me. I got to know Allison when she was a Council of Deans Fellow. And it was just been a delight to get to know her over those 2 years and to see her come to a school that I've been to. I was at UC Davis a couple years ago under your previous dean, and I got to participate in the wonderful program, that big pre-med program where there were thousands of students who were interested in pre-med. And so that was so exciting to me. And so thank you for having me again. I must have did okay that you all allowed me to come back. And so I've been given a few moments to share my thoughts, and then I think we're going to open it up for questions. Of course, I would have more slides than time allotted, so please forgive me if I go through them, but I think the pictures are going to say 1,000 words. So now I am going to ask that you allow me to share my screen, host. I think you allow me to share my screen. It says host disabled participant screen share. Okay, good. Okay. And my team has it set up so that I can't mess this up. And I am going to hit the word share today, Allison, because yesterday I kind of messed that up. All right. So I am going to assume that you all can see my screen. Is that correct? All right. All right. Then we have done about 90% of it now. I can move on for the day. All right. And so they asked me to speak briefly, you all, about the intersection of social justice, health, and well-being. And so I want to give you some of my thoughts about this. And my thoughts are definitely my thoughts. However, they are clearly influenced by my experiences. And so I'm going to start with this first slide, which I think says a lot, you all, because this is the times that we are in. We're in this time where we have people who are protesting in a very responsible way in most instances. They are peaceful. And then we have people here who are struggling just every day with trying to adjust to this pandemic and the challenges that are being posed by the loss of their loved ones. And so this right here to me says 1,000 words. And when you think about this, I am reminded of the Langston Hughes poem, I Too Sing America. I am the darker brother. They send me to eat in the kitchen, and when company comes, but I laugh and eat well and grow strong. And many people of color have been singing America for a while and are now just getting people to listen. Many of you are familiar with this article probably about 8 Americas. This was actually written, published in about 2006, 2007. But what the researchers did here, you all, they subdivided this country into 8 Americas based on our mortality rates. They saw patterns of longevity based on place of residence, controlling for race, income, education level, population density, and homicide rates. And what they were really able to see, that there were differences based on income, and there were differences based on high school graduation rate. When they looked at the county life expectancies by race though, what they figured out though, that the place in which you lived is important, but it's not so much the physical environment or the climate that makes a difference, but the social and cultural things that change with place. Culture largely defines what you eat, whether you exercise, and this has to do with you all, how you were brought up, that cognitive diversity, those experiences that you have, and what your peers do. Because once you adopt habits, you tend to keep them. We figured out, people, you all, that just going into a community and telling people what they should be doing is not enough to expect that people are going to respond and change their lifestyle. And so what these authors said is that we needed policies that would lead to sustainability, particularly in those areas where we had the lowest life expectancy and that were influenced by psychological barriers. So communities and place matter, you all. Experiences matter also. And this gets us to all of these social determinants of health that we talk about. Economic stability, the neighborhood and physical environment, housing, safety, parks, education, food, access to healthy options, community and social context. What is the social integration? What are the support systems that are in place? Is there discrimination? Is there stress? And of course, what does the health system have to offer? Because all of these are the things that are going to influence health outcomes. And it's not just about dying. It is about how you get to live. Now, if I bring this home to the social determinants of health, what we know in relationship to COVID-19 is that nearly a quarter of the employed Hispanic and Black or African American workers are in service industry compared to 16% of non-Hispanic whites. We know that Hispanic workers account for 17% of the total employment, but constitute 53% of the agricultural workers. We know that Black and African Americans make up 12% of all employed workers. However, they account for 30% of the licensed practical and licensed vocational nurses. And what we see, you all, in this United States is that COVID-19 infection rate is 3 times higher in the predominantly Black counties. So you look at the work in the roles where we can't work from home remotely. They work in the roles where the opportunity of exposure is higher. They live in multi-generational homes that are densely populated. It makes it hard to observe quarantine guidelines. So when we talk about health equity, you all, we have to talk about what is it that we need to put in these boxes for people to be able to stand tall enough to be able to look over the fence. So if this is our goal, if it's our goal to have healthy neighborhoods that are vibrant and people are able to walk and children are able to play and our youth are empowered, then we have to get rid of this. We got to get rid of food deserts. We must address the homelessness. We have to address redlining. I'm from Macon, Georgia. And this is what the redlining has looked like for the last 35 years. Now, supposedly it's over. But when I go back to my neighborhood, I could draw this map. I could draw this map on redlining. And what we know, you all, is that there's a clear connection all the way from the 1900s when the policies came about for redlining to how we get to health outcomes. It is place-based resources that are not in place for a healthy neighborhood. It is people being exposed to more untoward opportunities that lead to these inequities in health outcomes. And it clearly impacts our schools. Because if you look at the percentage of fourth graders in low poverty and high poverty schools by race and ethnicity, you can see that in those high poverty schools, that is where you see our Black and Hispanic kids and our American Indian and Alaska Natives. So when we start to talk about why the pipeline is leaking, and this is just for Black males, we know it begins with high school graduation. It then looks at resource allocations for who gets to go to college. And then we have to look at the systemic problem with prison incarceration. So we cannot be surprised then that at the end of the day, we end up with about 466 Black male matriculants in a year of 2018, 2019. And if we really look at US born Black males, it's even less. And it has not gotten better. It's a systemic problem that started many years ago. So how do we innovate? How do we beat these odds? We got to give thought to economic empowerment. We got to give thought to community enrichment. We got to advance policies for sustainability. Yes, we must build pipeline programs. And with each of those must be a pathway. You have to go back into the K-5 school and build opportunities that involve the parents and mentorship and what we feel comfortable with, and that's STEAM. Because you all, that's the only way that we're going to be able to prevent what we're seeing right now in this country, where COVID-19 is ravishing our communities. But they are highlighting these long-standing health inequities. Now, there are inequities, and then there's privilege. And so I tell everybody, we are witnessing right now one of the most flagrant examples of health inequities in this country. When you look at what happened not too long ago in the Rose Garden, and then you look at the fact that Governor Christie decided that he wanted to check himself into a hospital for preventive measures. I ask you, how many people you all wanted to check themselves into the hospital for preventive measures? This is what privilege looks like. And so when we start to think about how we're going to achieve health equity, you all, everybody's got to be able to have precautionary care and personalized care. Everybody within 24 hours of being tested positive for COVID ought to have access to advanced therapies, personalized care, concierge medicine. That's the only way, you all, we're going to be able to achieve equity, is by giving people what they need, when they need, and the amount they need to reach their optimal level of health. Because these people over here, this guy right here, he wants to look at the game also. This is why we're at this point. These are our Morehouse School of Medicine students who participated in our march. These are our people, our residents at Grady, who kneeled for the requisite amount of time in recognition of George Floyd. Here's our students, though, you all, for our convocation, socially distanced in 28 rooms with masks on. I too sing America. Tomorrow I'll be at the table when company comes, and nobody dare say to me, eat in the kitchen. Then besides, they'll see how beautiful I am and be ashamed. I too am America. There's equality, there's equity, and then there's liberation. And liberation, you all, is when we get rid of the fence totally. Thank you. Happy to address questions. I'm going to stop sharing. Wait a minute, let me stop doing that. Okay.
Thank you, Dr. Montgomery Rice, for sharing those powerful insights. It's really extraordinary. Now I'd like to introduce UC Davis Health's News and Media Relations Director, Pamela Wu, who will moderate our question and answer session.
Thank you so much, Dean Brashear. It's really a pleasure and an honor to join you today, along with our distinguished guests, to discuss such an important topic. While many of the questions that I'm going to be asking will be directed to an individual panelist among the three of you, I do encourage Chancellor May and Drs. Brashear and Montgomery Rice to share their thoughts and reactions as well. We want this to be as interactive among the three of you as possible. So if you want to weigh in, jump in, please feel free to do so. So I'm going to begin by asking each of our panelists a question from our audience. And the first question is for Dr. Montgomery Rice. And that is, given the current social climate, what do you think are the key challenges to making progress in health equity and achieving social justice?
Thank you. I think the first thing is the acknowledgement that they are tied together. And that unless we actually focus on social justice, and I look at that as all of those things that determine my right to exist, and to have equal access to resources that afford me to live my most optimal life. Included in that, though, is health, because without your health, you really do not have the opportunity to even realize the benefits of social justice. And so I think the first thing is we have to acknowledge the intersection, right? That they are strongly tied together. And then we have to ask ourselves, what can we do to influence policy? At the end of the day, sustainability of interventions only is realized through policy. So lots of people have had great intentions of how to address housing challenges or transportation challenges or even redlining, right? Many communities have dealt with that. But unless you wrap a policy around it that actually continues to monitor the protection that is afforded to those areas, then you will never see the opportunity for achieving equity. And then that, of course, will inform health equity.
Thank you very much for that very eloquent answer. It segues nicely into our next question, which is for Chancellor May. And that is, why is championing diversity and social justice important?
Well, thanks, Pamela. First of all, I have to say that championing diversity is important to me personally, and it's always been a driving force in my family, going back to the days when my mother was among the first group of students to integrate the University of Missouri back in the 1950s during Jim Crow. People think that stuff was so long ago, but for me and for many of us, that was just one generation ago. And then if you fast forward, when I finished graduate school in 1991 at UC Berkeley, that year, I was one of only about 30 African Americans to earn a PhD in engineering. That's 30 in the entire United States. You could have fit us all in one classroom. So, I was always motivated to try to make a difference in that situation and improve that situation. And at UC Davis, I'm here as Chancellor for all students. It's important that I advocate for everyone in our increasingly diverse community at the university. And I'm convinced that diversity leads to better outcomes. We don't do this just for charitable reasons or because it's the right thing to do, even though it is. We do it because it gives us a richer environment to produce the kind of scientific and other improvements that will increase the productivity and progress of society, whether we're talking about health equity or technological advancement.
Thank you very much, Chancellor May. Our next question is for Dr. Brashear, and that is, in what ways can academic research institutions, such as UC Davis School of Medicine, address health inequities and engage their communities?
Well, thank you, Pam. One of the things that's special about schools of medicine is it brings together the research, the education, and the clinical realm, and allows us to bring research directly to the patient bedside. And we do that best by having a diverse workforce. That means students, residents, faculty, staff. I'm very proud of the work that we did with the vaccine trial recently, where we were able to enroll 3,500 people. They volunteered, and we enrolled 200 people with an incredibly diverse background. That's how we're going to improve health. It's all by working together. And that's what schools of medicine are really about, improving health.
We're getting lots of great audience questions now. I invite any one of the three of you to jump in to answer this one. And that is, what is one way to get rid of the fence? Maybe we'll let Dr. Montgomery Rice take that one first, since that was her graphic.
When I developed that, my team sort of said, "Oh, that's pretty bold." So first of all, it takes courage. And you have to recognize that the fence actually exists. And most of the time you all exist on is unintentional sometimes too. Yeah. So let's say that we were addressed to provide people with all the resources they need to stand in the box, in every box that was the resource that somebody needed. And they could look over the fence, but they still could not realize the full opportunity. We then have to say, what is it in our circumstances? What is it systemically that's preventing us from doing that. And it is really about how we think about ourselves and we think about others. So when you think about unconscious bias, most people would not believe all the unconscious bias tendencies that they have. And whenever anybody takes that test, they're so surprised because they didn't know that that's how they really felt until someone brought it to them. So it is about educating ourselves, accepting the fact that we're not perfect, that we have unconscious biases. Because once we recognize that they exist, then we can work on what the solution would be to move that fence. Because most of the time, it is unconsciously holding us back from helping you to reach your full opportunity.
I love that answer. It's like we don't realize that we have, unfortunately, our own little inner fence builder as well. And so we can become fence removers once we recognize that that's inside of us. What a great point. Thank you. Question number 2 also is for Dr. Montgomery Rice, and that is, how do you deal with issues of discrimination in the workplace? What tips do you have for young professionals in the workplace? And this comes to us from one of our doctors in family medicine, who's also a UC Davis School of Medicine alumnus.
So I will give you this one example for me, is that, so I went to Georgia Tech, and when I went to Georgia Tech, when Gary and I were there were not many women who were chemistry majors, and I became a chemistry major because I decided to go to medical school instead of finish my 5 years. But I was a chemistry major until the last moment, right? And there were not that many women right there. And I have to tell you, I was so naive. I sort of thought it was just par for the course. It was more gender challenges than there were race challenges. We had a small community of underrepresented minorities, but we were very, very close and very, very supportive of one another. So I started to feel the gender challenges more so. That continued throughout the career. So I will tell people I've always felt more of the gender challenge than the race challenge. But I didn't understand some of the subtleties of the race. And I didn't really appreciate it until when I left the University of Kansas and went to Meharry Medical College. And I went there, and my husband said to me one day, "You just seem to have so much pep in your step." And I said, "Well, what is this?" And I recognized I didn't have to go to work every day and worry about race, because the majority of people were people of color. And so we didn't have race conversations. I wasn't making an assumption that people were not inviting me to the meeting or had some axe to grind with me because of my race. And so one of the things that I think that what we have to do in our majority environments is really begin to recognize the small microaggressions that are imposed on those individuals who are in the minority. And so now I think about it from a different perspective, because in my environment, my white faculty and students are in the minority. So I am always looking at it from the lens of what are they feeling. I think open conversation is very, very, very important. And as leaders, we have to create the spaces for open conversation. Now, people who know me know that I don't necessarily like this concept of safe spaces, because I think that all spaces should be safe. And I think it's up to the leader to create the environment for training, education, open conversations, people having time to acknowledge, and people having time to grow. And so when you are faced with the challenge, the one thing that I would begin with is a conversation. And if you don't feel safe having that conversation, then you should try to identify a person who can help be your advocate to have that conversation. But what you shouldn't do is continue to bottle it up, because that is what adds to the stress and anxiety of moving forward with your success.
Great answer. Thank you. Our next question from the audience, I think, is a great one for all three of you. The question is, would love to know what you see as some critical first steps that our institution can take, whether that be our institution of UC Davis or institutions in general in higher education. Chancellor May, let's begin with you.
I think certainly first steps involve representation. Representation matters. And I think, you know, we've strived in my short time here, 3 years at UC Davis, to diversify the leadership team, to make sure that everyone feels welcome and everyone has an opportunity to be successful. And I think when you can, you know, Joycelyn Elders, former Surgeon General, said this a long time ago. She said, you can't be what you can't see. Yeah. So when you can see yourself in other roles beyond where you are currently, that gives you some inspiration and motivation and makes you feel a little more welcome and comfortable. So that's what we're striving for at UC Davis.
Thank you. Dean Brashear, your thoughts on some critical first steps?
So this is one critical first step, is having the conversation and bringing Dr. Montgomery Rice here. Another is to really help our students, all of our students, achieve anything they want to be, to make sure that we have a diverse faculty, and we're working hard on that. And then to bring everybody together to make sure we're having honest conversations about how we can move forward even beyond that.
And Dr. Montgomery Rice, your thoughts on critical first steps?
You know, for us here at Morehouse School of Medicine, we sort of have the reverse issue. A lot of times people think because we have one of the historically Black medical schools that we don't have a diversity issue. And we don't have as much of a diversity issue. What we have is an inclusion issue. Mm-hmm. We really have to work on being more inclusive. We really have to make sure when I go to a laboratory, a research laboratory, and it is the PI is one race or ethnicity, that everybody in that person's lab is not the same race and ethnicity. And Allison is laughing and Gary's laughing because they know this happens all the time. Because what do? We migrate to our comfort level. Yep. And a lot of times, those persons who are working in those laboratories, even though they're well qualified, I don't mean to say that people are not well qualified, but a lot of those recommendations have come from relationships, right? And contacts. And so what we have to do is put in a system that requires there to be a diverse platform of people, not just the ones that we know, so that we can always find those bright spots. Because there are always these people who actually don't know anybody. You know, some people start out not having a wide network, right? And they deserve a chance too. And so ours is about inclusion. Ours is about inclusion, focusing on inclusion.
Thank you all for your great answers to that one question. My next question is for Chancellor May, and that is, as the Chancellor of a leading academic institution, how do you see higher education as part of the solution in advancing health equity and social justice?
Well, I think one of the benefits of higher ed is that it can serve as a socioeconomic escalator, if you will. And I'm especially proud that UC Davis continues to rank highly on social mobility metrics. Recently, Washington Monthly magazine ranked UC Davis #2 in the nation among public universities for social mobility. And this list recognizes, quote, not what colleges do for themselves, but what they do for the country. And it's really a reflection of our efforts to make quality education available to all of our students. And we're really providing a transformational opportunity. We have 40% of our students who are first generation. We have many students who are low income. So we're providing these opportunities for these graduates to really transform their lives and the lives of their families and find some career success. We still need these targeted programs to recruit and retain and help students succeed. And we need to work with our community on pipeline programs to reach students when they're young. And that's really how we tackle some of the educational barriers that impact some of our underserved students' family.
Thank you very much, Chancellor May. Our next question, I think, is best directed toward our two medical school leaders. And that is, how can we attract more African Americans and other underrepresented minority students to non-primary care specialties? And this question happens to come from our own Dr. Lydia Howell, Chair of Pathology and Lab Sciences. Dr. Montgomery-Rice, let's begin with you.
Thank you. So, first of all, I think Gary said what Jocelyn Elder said, you can't be it if you haven't seen it, right? Exposure, exposure, exposure. And then we as the students, professors, and persons who are engaging them cannot automatically assume that our medical students want to go into primary care. And sometimes we put that burden on students of color. So at Morehouse School of Medicine, I say to people, everybody, you can be an oculoplastic surgeon, but you're a primary care doctor until proven otherwise. And why do I say that? Because we should be teaching for a generalist education. That's what we're charged to do, that you can look at a patient holistically. And then we have to have a diverse experience for you in medical school that shows you how you can be both. I'm a reproductive endocrinologist and fertility specialist, but every patient that I would see, I would talk to her about, have you had your annual mammogram? Are you up to date on all your screenings, on your pap smears, all of those things? Because I knew from the data that sometimes I was the only doctor that person would be seeing, even though they were coming in for infertility treatment. And so it didn't take me away from being a primary care advocate for that patient, and then still being a reproductive endocrinologist and fertility specialist. And so we have to expose our students to how they can do both and have them have the understanding of their responsibility and accountability to do both of those.
So
Great, thank you. Dr. Brashear, the same question. How can we attract more such applicants to non-primary care specialties?
So I couldn't agree with Valerie. First and foremost, we want to train everyone to be an excellent physician. But then one way is to do exactly what she said. Make sure that our students have exposure to a variety of different professions and that they have role models to see that they can aspire to do that. I believe that our School of Medicine, once you're admitted to the school, you should be supported to aspire to be whatever you want to be. And as she said, maybe it's a neurosurgeon or an oculoplastic, as Valerie said, or primary care. Once we admit someone, we want them to achieve their fullest potential and achieve their dreams.
Wonderful, thank you. We're nearing the end of our time here. Before we wrap up the session, I have one final question for Dr. Montgomery-Rice, and that is, if you could leave us with one parting message of hope regarding achieving health equity and social justice, what would that be today?
I believe that we are at a inflection point at this time in the country, and that is, my daughter would say to me, people are being woke. Okay, now that's not a term that I would know how to use, and I'm still probably not using it right. However, I think COVID-19 has allowed for a time for people to pause and reflect, and they are seeing for the first time some of the things that many people have been seeing for a long time. They're getting to look behind the curtain of what happens in people's communities that have been happening for a long time. They're beginning to see what health inequity really is and how it leads to health disparities. And it's causing discomfort. And that's okay, particularly if that discomfort leads to a positive change. Mm-hmm. And so what I would leave with this audience is to not be afraid, to be uncomfortable, and to find a support network that allows you to have uncomfortable conversations, but not to stop there. Then move to a point of how do you have conversations that can lead to change, and to understand that all of us have a circle of influence. It doesn't have to be being the president or the CEO or the chancellor or the dean. It could be you being a school teacher or being on the school board or you working in your place of employment and being able to influence a group of people by having a conversation, uncomfortable conversation, and saying, how can we be better? Now, I preference that with saying, assuming that everyone believes that everybody should have the opportunity to achieve health equity, to achieve their optimal level of health, which I actually do believe that everyone should.
I'd like to thank Chancellor May and Dr. Valerie Montgomery Rice for sharing their valuable time and insights. It's just been powerful. Thank you, Pam, for moderating our Q&A, and thank you to all of our virtual participants for joining us. Have a really wonderful day.
So we have. Thank you. Can we go? Tell.
Thank you all.
Thank you.
Wonderful conversation.
Great job.
Thank you. Everyone have a great day.
Bye.